Does this say yes to the dress or say yes to the slut?
I still think it's really wild how I can just wear anything now. Hello. If you do not know me, which statistically is pretty likely, my name is Dorian, I am trans-masculine, and by the time you are seeing this video, it will have been 1 year since I had top surgery. I do want to mention that this is not at all the usual kind of content that I usually produce. I am a costumer. I make clothes, I go to costume-heavy events. I probably could write an entire thesis on the relationship between costume and gender euphoria, but I'm not going to, and I'm sure there's somebody else that already has, so... Anyway, I wanted to compile some things that I learned through my own recovery process that I haven't really seen mentioned anywhere, and I thought might be useful for other people going into surgery. As a disclaimer though, before we start, obviously, I am not a medical professional. Do not take my word over the word of your surgeon or other doctors. I can only speak to my personal experience, and your body and your circumstances might be very different from mine. Don't do anything stupid. All right, let's get into it. Now, first I thought I would give a sort of like baseline information about my surgery, what my process was like. So I had my surgery done at the Gender Confirmation Center in San Francisco. My surgeon was Dr. Alexander Fakeway. I highly recommend the place, by the way. They are very, good and, kind and friendly to their patients. They know what they're doing. It's their whole thing. Gender's their whole thing, obviously. They asked me a lot of questions about the specifics of what I wanted the final outcome to look like, which it never occurred to me that I would have so many options, but it does make sense. It is still a cosmetic surgery, technically. So I determined the maximum amount of tissue that can be left over. I chose nipple size and placement. I chose the shape of my scars. I decided whether I wanted my scars to be separate rather than joined in the middle, since my body type, shape, everything allowed for them to be separate at all in the first place. For the surgery itself, they said to expect it to go for at least about 3 or so hours. I was in there for 2. I have heard somebody say that they heard that for general anesthesia, people will count you down, and by the time they hit 1, you're asleep. They didn't do that. They kind of just hooked me up and turned it on. In the recovery room, the most prominent pain I had was in my throat, actually, which I think was partly from the anti-nausea patch that they prescribed me for the night before, and partly from the anesthesia process. They'd have to, they shove a tube down your throat so that you will stay breathing. They do that while you're asleep, by the way. They don't do that when you're awake. They wait till you're unconscious. They actually accidentally cut the flesh in my throat that attaches the uvula to the rest of the throat. I guess they were having some trouble getting the tube down there. So I had this weird extra flap situation going on back there, and I could feel it with the back of my tongue. And I thought I was gonna have to live with that forever, but it did heal itself. And I was only in the recovery room basically until I woke up. They made sure I was okay. They gave me some applesauce because they said that would help with the throat pain a little bit. And then they basically, they helped me put the rest of my clothes on, and then they wheeled me out to the car. My recovery afterwards was remarkably smooth. I had no adverse reactions to the anesthesia, partly of course because of the medication. I had very little pain. I believe I regularly took the anti-inflammatories, and I sometimes took the opioids that they had prescribed me. I had an extra anti-nausea medication that I never took, and I did not experience post-op depression, which is weird, actually. I was fully expecting to have a grieving period. None of that. I had never had a surgery before. Turns out I'm just a super chill, post-operative human, which is not something that I was expecting from my body. I did have one small complication. So this place does one in-person follow-up appointment 1 week after the surgery. And that's when they take your stitches and drains out, and they give you all the rest of the materials that you need, and then they'll just send you on your way. So at this appointment, when they tried to take my drains out, they found that one of them was stuck. So my left drain had accidentally been stitched to a lower layer of skin while they were closing me back up, and so they had to go back in and reopen part of the scar so that they could cut those threads and pull it out. And I actually could feel it in the week before the appointment. If I bent over, I would feel a little bit of pain right here at the end of the scar, and I was like, oh, that must be because there's drains in there. And it was because there was drains in there, but just because it was attached to my skin. So very rare for that to happen. He said that I was like only like the second or third person that he's ever had that happen to. But also if it does happen, it's generally not very difficult to fix. Now, my restrictions for going forward after surgery were that for the first 3 weeks, I wore the compression binder. I could not raise my arms above 90 degrees perpendicular to the torso. I could not lift more than 5 pounds, and I was to keep my heart rate down and keep a low sodium diet to prevent swelling. At 3 weeks, the compression binder comes off. I could lift up to 25 pounds, and I could do things like light cardio again. I could get my heart rate up again. I believe at this point I still could not lift my elbows above my shoulders. And then at 6 weeks post-op, you have no more restrictions and you can fully go back to whatever kind of movement you were doing before surgery. If you look on the Gender Confirmation Center's website, they still have a few pages that say that you shouldn't raise your arms above your shoulders for 6 months after surgery. That's not accurate. I actually had a nurse mention that and be like, don't like disregard that information, don't look at that. Because those instructions were mostly there for the purpose of like minimizing your scars. And even if that is a concern for you, it's still better to have this range of motion. Like doing this is really important. Okay, getting into the actual advice now. First point, a piece of advice that I saw prior to surgery was to put things in your house on lower shelves so that the things that you need to grab often are easy to reach. Absolutely do that. In addition to that though, if you can acquire some kind of grabby device that will extend your reach to a higher point above your head, you will have a much easier time when you need to reach something that is outside your allowed range of motion. So like maybe something like one of those trash grabbers. I had this on hand. If you can't get your hands on something like that though, like a stepladder, or something that can be regularly used as a stepladder, just something that will let you reach high places without raising your arms will do wonders for you in the times that you really need it. Number 2, do mobility exercises. I am so serious about this. You would not believe how quickly your muscles will just atrophy if you limit their use. And by exercises, I obviously don't mean anything that's like actually strenuous. I just mean that it is good to regularly take some time to use the maximum range of motion that you are allowed at a given point. Generally, in the first several weeks immediately post-op, you want to keep your arms as close to your chest as possible because you don't want to put strain on the incisions. However, as a result of that, these muscles will tense the fuck up. And obviously that's not to say that you'll never get that range of motion back, like that would be kind of ridiculous. But if you take a little time to stretch these out within the bounds of your movement restrictions, your muscles will just have an easier time recovering that mobility. So what I would do after my first week and after I got my stitches out and everything was for like 10, 20, 30 minutes a day, I would lay on the floor to help straighten out my back because I was victim to like the compression binder hunch. And I would put my arms out at about 90 degrees to my chest, a little bit lower starting off, and then eventually I would work my way up to like actually 90 degrees. And then I would very slowly, very carefully try to lower my elbow to the floor. And that's it. That was the exercise. And that doesn't seem like it should be hard, but like again, they stiffen. Right. I also gave myself assistance with this because I didn't want these muscles to be working against gravity. So I remember I would hold my hands together and use the like supporting arm to lower the stretching arm. Or similarly, since I was laying on the floor, I could put a resistance band around hold on. These things. Okay, this is a resistance band. So I could put this resistance band around my foot and hold on to the other end of the band and use that to lower my arm, which would also free up the other hand, and then I could use that to hold my skin in place. Eventually, as that motion got easy, I would gradually increase the difficulty and start working on moving my arm from this position into this position. And throughout this process, I would always anchor the skin right under my shoulder so that the muscles could stretch, but the skin wouldn't move too much. It wouldn't put strain on the incision. I also took this time to massage my scars, by the way, which is a good thing to do, but you probably don't need me to tell you that. Okay, third one. This is another thing that's kind of only useful to know if you are still pre-op, but you know. So I shaved my armpits right before surgery, and I do think that was a pretty good move. In the first week after surgery, you can't take a shower. You can only do like a sponge bath kind of thing. And I shaved under my arms to just make that a little easier. And I do think it made it a little bit easier than it would have been if I hadn't done that. Because like, you can only lift your arms up to here, you're wearing a compression binder, you can only move your torso so much, you're probably gonna have somebody helping you to some degree. Like, I think it helped. Okay, fourth one. This one. People are going to tell you to have a lot of button-up shirts on hand because you can't put your arms up over your head to get a shirt on. This is good information. However, I personally found that I still struggled a lot with putting on like button-up shirts or pajamas or whatever, because to some extent, no matter how big the shirt is, you still are going to have to get your arms behind you to put it on, and that stretches your chest out. So I usually had to have somebody help me to put the jackets and shirts and whatever on, anything that opened in the front. I did not, however, need any help with just t-shirts and sweaters that are really big on me. Those I can very easily put on without moving my arms away from my body. Like, look, I'll do it for you. Look at this, watch. Okay, so this, for instance, this is like an open front kind of thing. Let's put my phone somewhere where it'll actually record audio. This is a similar kind of fit to like the peacoat that I wore in the winter that I got it. And like this, you can't get this on without like, you gotta stretch your arm behind you, you gotta like, so I had to have somebody behind me to like, I would have to put my arms back here like this, and they'd have to like scoot it up onto my shoulders like that. Otherwise I can't, it's arm movement, you know? Whereas something like this, big ol' sweater, right? You put your arms in, you get your arms through the sleeves. That doesn't require moving your arms away from your body at all. You can just kind of like, find your fucking hands first of all. And then from here, you just kind of bunch it up and scoot it over your head. And then from there, like, I find this to be so much easier, personally, than trying to navigate a button-up garment while not moving my arms, if possible. And the same thing goes for taking it off, too. Like, you just kind of, like, reach in, scoot it off your arms. It's the same process, but in reverse, and you just kind of up over your shoulders, and there. And my arms didn't have to move at all. So, people are gonna tell you to have button-up pajamas. If you do not have button-up pajamas, but you have a really fucking big t-shirt, you will be fine. Number 5 is to be gentle with your adhesive dressings. Okay, so after you get your stitches out, you have to change your nipple dressings, assuming your surgery involved your nipples, or that you kept them at all, because some people don't. But anyway, if you have dressings on your nipples, you have to change them every day. The materials that they gave me for that involved a wet dressing and then an adhesive bandage to go on top of it. And I was putting it in like, kind of the exact same spot every time, and the adhesive is very strong. And by no means was I like ripping it off or anything, but like, I think the skin probably didn't have enough time to recover properly, and one time I ripped a little bit of skin off and I was like, oh, okay. So like, be careful. Even if you're not being particularly rough, it can still be a lot. I ended up dealing with that by sort of like trying to stagger where I placed them every day. And then towards the armpit where the skin is a little more delicate, I actually put a bit of a piece of toilet paper, like sort of on half of the adhesive strip so that it would stick like up here but not down here. And I think at this point I was not doing the wet dressings anymore. I think I was just doing the dry bandages, so it didn't need to be as secure anymore. Number 6, okay, all right, this one. I have not seen anyone speak about this ever. I have never seen any information about this. There's probably someone who's mentioned it somewhere. There are like a bunch of post-op recovery vlogs on YouTube, and I haven't watched any of them. So like, but regardless, I haven't seen this information before. So I didn't know anything about this going in. And this is not like a tip that's something to do so much as it's just something good to know. If your surgery involves free nipple grafts, and probably any other surgery involving any process of the nipples, but I can only speak to grafts, your nipples will be horrifying to look at. Which, I mean, like, obviously it's a surgery, things get fucked up, but like, horrifying. So you have like the areola, right? And then you have the nipple part of the nipple. That part, immediately after surgery, is just 90% whole. Like you just have a massive fucking hole in your nipple. And it's frankly not really super pleasant to look at. And so for the first couple of weeks, your nipples will they'll just be leaking pus, and that's why you have the wet dressings. That's why you have to change them every day, because your nipples are super fucked up. They finish closing up at around the 2-week mark, I believe, and then you switch to just dry dressings. And like nobody warned me about that. And it wasn't even like, I mean, it wasn't the grossest thing ever to look. I mean, it certainly wasn't pretty, but it was honestly, for me, it was more just like looking at them made me so very aware that like there's a giant hole in my nipple and it goes all the way through, and it's just like, I hated it. Although this is also coming from somebody that like cringes in secondhand pain if I think about nipple clamps too hard, so like I'm already like, ugh. Number 7 is actually not a tip, but a resource. Circ Physio on Instagram, Dr. Jen Crane, is a physical therapist who specializes in working with circus artists or other high-intensity athletic performers, so like dancers, Olympic athletes, etc. And she has created a number of informational resources specifically around recovery from top surgery. And for the most part, they are also relevant to trans feminine top surgeries as well. So she's got like a handful of posts with some upper back mobility exercises that you can do preemptively before you even have a surgery date. She has a case study that she put together with S. Hodelmoser, a strange wonderful creature on Instagram, that documents S's recovery from top surgery. She also has this little like fill-in page that you can get as a PDF, and somebody on your surgical team can fill it out. And if you're seeing a physical therapist during recovery, that will give them specifics on what kind of movement work you can do at certain points in time. And recently, she has been working in collaboration with Dr. Scott Mosser of the Gender Confirmation Center to establish a standardized protocol for top surgery recovery. I don't think they're like done cooking that yet, and I also think it's like primarily for medical providers, but like still, you know? And this kind of information is gonna be most relevant to people who are like in the range of like circus levels, kind of rigorous use of the body, but like even if you don't do anything like that, it's still good information to have. It's like, it's still good for you to like do stuff for your upper back mobility, even, I mean, regardless of whether you're even going to have a surgery at all. Like, I know you hunch over your phone like this, like I do. So that's all the information I have for you today. I hope that this stuff can be useful to somebody. If you happen to be watching this because top surgery is not currently accessible to you, and you're like, trying to live vicariously through other trans people, I have another video that could potentially be of use to you. I made a process video a while ago about a binder that I designed to be compatible with long-time wear and strenuous activity. So if you sew and are in need of maybe a binder that doesn't compress your chest so hard, you could check that out and, like, you know, to pick my brain about how I made mine. I'll have a couple links in the description, like the link to the Gender Confirmation Center's website and Circ Physio's Instagram page, as well as my links if I happen to interest you at all. And I wish you good luck either with getting yourself a surgery or a smooth recovery, or if none of that's relevant to you, then may your pillow be adequately cool tonight. I don't know. Bye. I would like you all to know that when I was in the recovery room immediately after waking up from surgery, aside from how much my throat hurt, the only thing that I could think of was that fucking Garfield comic. That was the first thing in my head after I woke up from surgery. Is this shot crooked? Have you been crooked this whole time? Hi, can I help you? No, you had a snack recently. It's not even 2. Girly pop, what happened to sleeping? You were having a nice time having a little nap. Are you gonna cause problems for me now? In collaboration with Scott Mosser, Dr. Scott Mosser, we'll be nice about that. I'm gonna propose something to you, and that's that you go back in your little tower, because you're not gonna have a snack right now, sorry. So at this appointment, when they tried to take my brains out, got lobotomized at the Gender Confirmation Center. Every kind of like vaguely historical look I do nowadays with this hair color, it always just turns into astarion.